Hello, wonderful students. Welcome to Nursing Informatics. Here are the learning objectives for this chapter. Please take a moment to review each one of these. Here is the American Nurses Association's definition of nursing informatics. Informatics in nursing continues to grow with the emphasis on it being able to assist the nurses with technology and data collection to improve patient care and patient outcomes. Nursing informatics supports not only nursing, but the entire healthcare team, as well as patients and consumers of healthcare. The whole goal is to improve patient outcomes through the collection and availability of meaningful information. Nursing informatics stretches beyond, well beyond just, not just the hospital EHRs, right? We're looking at tons and tons of information. Telehealth, mobile devices, patient portals, right? Where patients can log into a computer and access, like I said on the other recording, Honor Health's Epic system. They can see MyChart, look at their records, right? So pause the video and read through these. The components of the system development lifecycle are very similar to the nursing process, but with an emphasis on informatics and technology. The steps to the process are listed on this slide. We will go over this process in the details in the upcoming slide. The first step before planning any change in technology is to ask these questions listed on this slide. What are we trying to accomplish? Will it make it better? Or will it be a burden? Will it make a difference in patient outcomes? Sometimes these questions aren't asked and people go right to the technology that is most impressive at the very first glance. The design must involve the clinical staff that will be using it to assure a good outcome. Things like screen display, supporting workflow, using standard terminology, all of these things should be considered. You must also consider what training is going to be needed for all the different healthcare team members in order to be implemented and get it up and ready to use, right? All of those variables are important to know. Once the technology is up and being used, then you must consider the maintenance that will be needed to keep it running. These tasks are listed on this slide, so please pause the video and read through each of them. And just like the nursing process, we must evaluate the effectiveness of the technology. Did it do what was intended? Is it improving patient outcomes? Again, pause the video, read through these. There are some concepts that are important to know in regards to technology. The first is usability. Did it really work as effectively as it intended? System optimization refers to using the product to its fullest capacity. Are the alerts effective? Is the system supporting nursing care to the fullest capacity? Standard terminologies help everyone speak and communicate using common terms that everyone should be able to understand. Interoperability refers to the ability to share informatics and patient data across healthcare systems. This way, information from one provider's office can be shared with whatever other healthcare systems the patient may access. The contents of the medical record could be made available from anywhere where there's an internet connection. So we have a place in several safeguards to protect our patients' privacy as well as keep that information confidential. The patient portal is a web-based tool that provides several functions to the patient. It allows access to the medical histories. It allows us to communicate with our patients so the provider can communicate directly with the patient via the portal. It helps the patient view lab results, helps them schedule appointments, view their bills, access educational materials. The benefits of the patient portal includes better health outcomes, better chronic condition management, better timely access to care, and better patient retention. Healthcare analytics comes from the data entered on the patient. It can collect clinical data. It can identify at-risk populations, help make administrative decisions, as well as track financials. If it's entered into the database, the information can be pulled to create reports. Data visualization is the transformation of data into meaningful graphs and charts. Predictive analytics uses statistical techniques to predict possible complications or people who may be at risk. Big data is the collection of all the possible data banks on patients and come up with conclusions using all the data combined. Telehealth, telemedicine, and telecare are methods to connect patients using technology. Telehealth includes interacting with your patients via video conferencing, long-distance viewing, streaming media, and wireless communication. Telemedicine is the use of telecommunications to support and deliver medical care. And then telecare is when patients can receive care in their home. This can include exercise apps, digital medication reminders, could be early warning detection systems like blood glucose monitors that will give a patient, warning if a blood sugar drops too low. It saves time and it saves money, right? Last slide. Genomics addresses all genes in a patient and their interrelationship to identify the combined influence on health and illness. It can be used as a screening tool or to make a diagnosis with appropriate treatment measures. It can also determine carries or specific genes that might carry a genetic disorder or that might increase the chances for developing a certain disease. Pharmacogenetics uses information on a person's genetic makeup to choose the medicine or treatment that would work best with their genetic makeup with that patient. This is like not prescribing a beta blocker for an African American patient because studies have shown that genetically it is not as effective as an antihypertensive med as other antihypertensive medications. Another example will be, for example, chemotherapy agents work better than other certain types of agents on cancer, right? So we would select a certain chemotherapy drug, right? All right, this is the end of the chapter on nursing informatics.